Doctors at Dartmouth Hitchcock Hospital in New Hampshire have seen COVID-19 surge after surge, but not like this one. US COVID hospitalizations have rocketed by nearly 50% in the last week alone. And there are profound effects from what medics are calling a surge of the unvaccinated, who are, in turn, creating staff shortages by infecting them.
We can't do what we normally do. We've restricted and almost eliminated entirely elective procedures because we don't have the beds. The beds are full in critical care and other areas of patients with COVID. You know, the typical surgical admission could take maybe 3 days in the hospital. A very typical COVID admission could be 3 weeks.
It's a similar picture across the country. Some hospitals are reporting up to 2/3 of patients testing positive for COVID once they're admitted.
If hospitals are being overwhelmed by the unvaccinated, then even those who are fully vaccinated are not being spared right now. For employees who catch COVID, it means isolating and working from home, or even taking time off if working from home isn't an option. And that problem is so acute for the United States Postal Service, it's asked the federal government for a 3-month reprieve so it can meet vaccine and testing mandate demands.
The Biden administration is deploying military medics to hospitals and some 2.5 million pieces of protective equipment for staff. And while about 62% of the US population is fully vaccinated, millions more remain completely unvaccinated. But the eligibility for booster shots has been widened. Health authorities on Wednesday endorsing Pfizer-BioNTech's booster for 12 to 15-year-olds instead of just those 16 and older. Owen, Fairclough, CGTN, Washington.